ashver.com.
Hello, welcome to ashver.com. You are watching an interesting video about how to cure sharp upper back pain between shoulder blades. Please read the disclaimer carefully. Many of those experiencing upper back pain between shoulder blades merely think that they're suffering from a common problem. They believe that they've just been working too much. Well, even though it's possible that the concern simply stems from bad posture and excessive movement, there's also a chance that the issue is a sign of a life-threatening disease. So, instead of dismissing the pain as nothing, it's much wiser to spend time reading about its many faces. A spinal dilemma. Pain in the upper back could be related to spinal issues. Here's one example of those ache-inducing problems: swollen facet joints. The spine's flexibility is actually provided by those joints. In other words, they're always used to carry out many kinds of movements. Turns and bends are just a few examples. As with any other part of the body, facet joints aren't invincible. If used far too often, they end up damaged and swollen. Of course, swelling leads to soreness. Here's a concern that could prove to be much more serious than facet joint dilemmas: a herniated disc. That medical condition emerges when the spinal disc's innermost portion, which is gel-like, moves outward, through the disc's solid shell. Why exactly does that happen? Usually, excessive movement and aging-induced disc collapse are to blame. Lifting things the wrong way and trying to support too much weight are also both common culprits. Injuries, though, are among the rarer causes. Just like swollen joints, herniated discs cause pain. However, the latter tends to spread discomfort throughout the arms as well. Here's another interesting fact about that health problem: it may also be accompanied by numbness. Since far from intact discs affect the spinal cord in a physical way, through compression, then learning about the existence of that additional symptom shouldn't be too surprising. Well, surprised or not, no one should underestimate those big bile problems. Biliary colic is another medical dilemma that shouldn't be taken lightly. While it doesn't manifest throughout the spinal region, the disease is more than capable of causing upper back pain between shoulder blades. Of course, many would have one question in mind after reading that: where does the concern develop? It could start either in the gallbladder or in the bile duct. Regardless of where it first emerges, though, the result is the same: an episode of sharp, intense soreness that starts from the abdomen and branches out to the upper back region. A course of action. Upon becoming aware of facet joint issues, spinal disc troubles, and bile-related problems, many would surely wonder whether there's a guide on how to distinguish those three from one another. Likewise, people who have finally become a lot more concerned about their health would want to know whether there's a what to do guide that they could follow whenever they feel pain. There's no need to worry about finding those things, especially since they're all here. Brief, mild aching could indicate either swollen facet joints or herniated discs. Experiencing this kind of soreness is a nuisance at best. Doing all sorts of chores and completing all kinds of office work should still be possible. It should be emphasized, though, that even the mildest conditions could turn into most serious health concerns if proper actions aren't taken. That's why these steps are important to remember. Rest for a while and see whether the pain subsides. If the aching stopped, think about these suggestions. Do some stretches before engaging in any physical activity. Consider exercising routines that benefits the upper back. Don't move suddenly and quickly to avoid additional strain. Exert effort to correct common posture problems. Long, moderate pain could also indicate the presence of either one of the two issues mentioned. In this case, though, medical attention might be necessary. Moderate pain that stays for half an hour or more sometimes means that the ache-causing concern has worsened. If it to get worse, then doctors already have to use certain imaging technologies, such as X-ray for facet joints and MRI for herniated discs, to determine the damage's extent. Intense pain, numbness. If the episodes of soreness are almost unbearable and there are instances in which certain parts of body experience numbness, or in some cases, tingling, then it's definitely a must to visit a physician. Together, such symptoms are considered a telltale sign of serious spinal disc dilemmas. If left unchecked and unresolved, a severely herniated disc could even cause paralysis, due to permanent nerve damage. Noticeable pain, nausea, periods of upper back pain, between shoulder tend to differ in both intensity and duration, when accompanied by nausea, is synonymous with biliary colic. In fact, some medical experts suggest that it's best to immediately call for an ambulance if ever that combination of symptoms manifest. Also, those who've been suffering from aches after they've eaten, another warning sign, should really be wary of. Matter of solution. So far, it has been made obvious that upper back pain, between shoulder blades, is linked to several health problems. As also made clear, those medical issues aren't equally dangerous. Some merely cause temporary discomfort, while others could prove to be fatal if left untreated. Well, they're also solved, or at the very least, managed, in different ways. Swollen facet joint. As discussed above, the mildest joint troubles could actually be stopped from becoming worse through fairly simple techniques, such as following the right posture and avoiding sudden movement. The condition's more troublesome kinds, though, usually require the aid of a physical therapist, so that the right regions would be strengthened and made more flexible. Individuals suffering from more serious cases of facet joint concerns are given these options: to undergo a procedure called nerve blocking so that the soreness would subside. People wondering what's done during the procedure would most likely end up shocked after realizing that steroid injections are involved. To take painkillers and muscle relaxants on a regular basis. While minor cases of the spinal problem can be effectively handled using over-the-counter medication, the condition's more alarming variants require powerful prescription drugs. Herniated disc. Treatments for this medical issue are similar to the ones developed for swollen facet joints. Doing spine-enhancing exercises and being mindful of the body's position are more than enough to solve the concerns faced by people with minor disc hernia. Sometimes, anti-inflammatory injections and pain medications are added into the mix. Surgery is only reserved for very severe cases. After all, it's the solution that comes with the most risks. Biliary colic. People who develop this disease undergo a treatment process that takes advantage of 4 different types of medication. In particular, they're asked to take NSAIDs, antibiotics, spasm fighters, and anti-nausea pills. Aside from that, they're also told to pick among the many ways cleansing the gallbladder and the bile duct. Well, only one of those methods isn't surgical in nature: oral dissolution therapy. Unlike surgery-type solutions. Do the right thing. Soreness in the upper back region, particularly between the shoulders, shouldn't always be dismissed as a minor problem. In some instances, the aching sensation is already a sign of spinal degradation. In others, it means that a dangerous digestive system disease emerged. All in all, people who've been experiencing upper back pain, between shoulder blades, as of late shouldn't wait until their health has worsened before even thinking of making a move. Thank you for watching this video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find lot of interesting videos on wide range of topics here. Stay tuned and keep watching.